Novaerus is founded on the premise that for several generations we've been improving hand hygiene and sterilising surfaces, with no significant reduction in the last 10 or 20 years in infections. Without treating the air, we can't see a meaningful reduction in infections beyond where we are today. Novaerus uses a patented plasma field technology to destroy all viruses, all bacteria, gram-positive and gram-negative. We denature molds, mildews, and we also, as an added benefit, neutralise all odours. For generations, the healthcare industry has been struggling with infection control levels. For over 100 years, we've been washing our hands with alcohol, wiping down surfaces with bleach, without any kind of comparable reduction in infection rates. Over the last 20 years, infection rates in long-term care facilities still hover around the 10% rate. Without treating the air in a facility, we've reached the point of diminishing returns in infection control. Novaerus is not a standalone product. We believe it has to become part of the overall infection control protocols in your facility. One of the problems that has plagued the long-term care industry for generations is the prevalence of HAIs, typically called hospital-acquired infections or healthcare-acquired infections. Many of these infections enter the long-term care facilities directly from the hospital and are as a result of a direct stay in a hospital. The problem is that residents typically don't present with symptoms of these HAIs for 3 to 4 days post-admittance. This is problematic in that they've already been in contact with other residents in the facility. One of the creative uses of our technology is to use our isolation pack. By doing so, for the first 4 days of every new resident's admittance time, we place one of our units in the room with them, and it provides a virtual isolation space. So if they do arrive with something inadvertently that they may not know they have, or you may not know they have, you've protected your facility from the spread of these dangerous infections, such as C. difficile, MRSA, or even norovirus. As well as the incredible savings that Novaerus can bring to a facility, many of our more advanced users are using Novaerus to help them in co-branded marketing. Novaerus provides a significant competitive advantage in a crowded space that you can differentiate yourself from your competitors.
So within the novaerus unit, there's a plasma, a dielectric barrier discharge plasma, which is known to be very effective at deactivating microorganisms. So the air is pulled in by a fan into the novaerus unit. The air is exposed to the plasma field for a short period of time. During that short period of time, the microbes are exposed to the plasma and hence they're deactivated. And then the air is pulled through the rest of the system and back out into the room.
My name is Marco Carrasco. I'm the administrator at West Gables Healthcare Center. We're a 120-bed skilled nursing facility. We ventured into working with Novaerus to become the first skilled nursing facility to pilot this product. We've tracked sick time right now, and we compared it last year at this time to now, and we've seen a 10% reduction in our costs. And that's truly, I think, part of our success with Novaerus. Novaerus, not only would I recommend to other facilities, but I would also recommend outside of healthcare facilities. We're really excited to know that we're protecting our facility.
Today we're going to cover some important information about your Novaerus airborne infection control units. This is the Novaerus NV200, the portable air plasma unit. The NV200 was designed for use in resident or patient rooms or other areas up to 200 square feet with a maximum ceiling height of 10 feet. This is the air intake on the Novaerus NV200. The air is drawn through the top, then passes through our patented air plasma field, dispensing clean, sterilized air from the bottom mesh of the unit. Similar to the NV200, the Novaerus NV400 is the same size, but with a more powerful fan, which can cover up to 400 square feet of space. This is the Novaerus NV600, which must be mounted on a wall and is not designed to be used as a freestanding unit. The NV600 is recommended for usage in larger spaces and common areas. Each Novaerus NV600 covers 600 square feet of space based on a 10-foot ceiling height.
My name is Catherine Reed Kastner. I am the president of Bay Oaks. We are a nonprofit organization that has been in existence for 66 years. There is no comparable to what novaerus offers, because while you can clean the surfaces of areas, there's no other technology that I'm aware of that encompasses airborne factors.
My name is Randy Kernan. I'm with Indigo Manor Nursing and Rehab. I'm the executive director. I've been a skilled nursing administrator for about 35 years. I would highly recommend novaerus. They've been in our building for about 8-9 months. We've seen some very positive outcomes from it. Patient satisfaction, employee satisfaction, reduction of infections, malodors in the building. I think it's a very cost-effective means of taking care of a lot of issues that we have in our environment today. I would highly recommend it. I think it's something, it's ahead of its time. It's something that's very much needed. Your system, novaerus, it actually eliminates a lot. And, we use good practices as far as making sure the patients are changed on time. So there's, try to reduce the malodors as much as possible. But sometimes you can't. And once we brought yours in, we seem to have more of a consistent non-odor, throughout the building all the time, which is nice. I notice our infections through the flu season were a lot less than they've been in the past. I mean, big time. So that was pretty cool. I was waiting for it to hit, waiting for a hit. And if we did have a incident or where we had an area, we were able to contain the area and it was gone. It's done everything they said it would do. And the company's been a very good company, very proactive, very, like Johnny on the spot as far as taking care of things. So that means a lot too. It's a positive impact for everybody because you have less malodors. It's actually got a really fresh scent to it. So, it helps everybody's environment. If you've got a reduction in, infections and different things, it's going to help everybody. And it's at a cost where you can afford it. So overall, we've been very, very satisfied. It seems like the re-incidence of infections or flu-type symptoms, stomach-type viruses, those things seem to be shorter. That's the thing I'm seeing, shorter, condensed, periods of time when we have the issues, and then it's gone.
My name is Ramon Flores. I'm the administrator at Lakeview Care Center in Delray Beach. It's a 120-bed skilled nursing facility. I would highly recommend novaerus units to be used in other facilities because the product works, and we have received the results that we wanted. I would tell them to get the novaerus units because they do what they're supposed to do. And you get the clinical results will validate what I'm saying, as it has for us at Lakeview Care Center. We don't use any other infection control technologies right now in the building. Partly, I'm sure the reason for that is the novaerus units are doing what they're supposed to be doing and keeping the air clean for the residents, staff, and families to breathe in. We had a norovirus outbreak about maybe 6 months prior to knowing about the novaerus products. And we obviously it's a concern for us because during that it was about a 10-day period when we couldn't admit any patients to the building. It's working fine. We're getting the results that we wanted. Obviously it's cleaner air for everybody to breathe, and we were so impressed with the demonstration that was provided and the testing phase, if you will, of the units to get us to buy into it, and it's as we expected. It's working the way it should. Since we've been using the novaerus units, we have seen decline in rehospitalization, which is one area that we look at in our quality assurance program, and also the nosocomial infection, which has also gone down. Since novaerus was installed, we haven't had any complaints from the residents regarding illnesses of any sort. We have seen a decline in staff illnesses with regards to airborne pathogens.
We've all seen the headlines. Drug-resistant superbug hits U.S. hospital. Record flu outbreak closes long-term care facility. Healthcare facilities are constantly under attack from viruses and infection, but we're all washing our hands and cleaning surfaces. Isn't this enough? No, because the problem isn't going away. 99,000 Americans die every year from healthcare-acquired infections. That's more than AIDS, breast cancer, and automobile accidents combined. HAIs cost the healthcare industry over $40 billion every year. The problem is that infection spreads through the air. Things like opening curtains, making beds, or flushing toilets force pathogens into the air. One sneeze produces 40,000 droplet nuclei, spreading the risk of infection. Viruses are simply too small to filter. That's why current prevention methods, like HEPA filters, don't stop infections from spreading. Imagine what's in the air at your facility. At novaerus, we know the solution is in the air. Our patented technology uses air plasma, the most effective sterilizing agent for everything from surgical instruments to semiconductors. novaerus technology sterilizes your air, eradicating airborne infection. Clinical trials show that novaerus eliminates viruses, bacteria, and odors. Plus, our portable units let you isolate infected patients or proactively treat your common areas. Simply put, with novaerus technology, viruses and bacteria go in and only sterile air comes out. Your air is continuously cleaned to near theoretical perfection all day, every day. And the results are staggering. novaerus decreases respiratory infections by up to 70%, reduces staff sick time by 45%, and reduces respiratory readmission rates by up to 50%. A recent clinical trial showed that treating the air with novaerus reduced surface bacterial counts by over 68%. Air matters, so don't be another headline. Use novaerus in your facility today.